somebody had written to me about their concern as a new employee in the dental office that the dental office they're working at doesn't walk out treatment plans. They don't present the treatment plans to the patients, and they set them up for the next appointment, and then the patient comes in and gets the work done, and they don't know the entire treatment plan. And there was a concern about that as this person is new to this practice. And I want to address that question because I understand the concern, and I want to kind of put it in perspective for anybody who's thinking about, do I need to make sure I'm presenting stuff to patients or not? The whole treatment plan or just parts of the treatment plan. So let me jump into this. I remember when I was a kid, before I got into dentistry, that it felt like every single time I went to the dentist, every cleaning, there was something new that had to be done. There was, every time I went in, there was a filling. The next time I went in, I needed a crown, or I shouldn't say as a kid, but I guess in college, young adult. And I was so frustrated because I worked super hard with my oral hygiene. You know, I know that I have issues, but it just seemed like a failure to me. Flash forward 20 years later, I know exactly what was happening back then, but I didn't know it at the time. The problem wasn't me. The problem wasn't my oral health. Maybe it was, but my home care. What the issue was this dentist knew I had all of these things going on, but for whatever reason, didn't present the entire treatment plan to me. For whatever reason, whether he was afraid or he didn't look at me comprehensively or was worried because I was a young adult with no money. I don't know what the case is, but he just presented one tooth at a time every time I came in. I'm kind of upset about that at this point because, first of all, I had low self-esteem on my home care, and then second of all, I deserve as a consumer to know what I'm walking into, what I have going on. On top of that, we are their healthcare providers. We are, I wouldn't want to go to the doctor and have them tell me I have a sprained finger and not tell me that I also have heart issues, right? Just one thing at a time. I want to know everything that's going on with me. Now, I may decide not to do everything, but I want to know. So we as dental office professionals, we as dentists and dental teams are doing our patients a disservice when we're not presenting them everything they have going on in their mouth. Now, we should be working with our patients to help them with a priority and financing options and all of that. But we definitely want to make sure when our patients come in and we do an exam or they're an emergency that we go over everything that they need. And then we can work with them on the details. And the last part of this is that if we're not presenting to the patients what they need, and we're not going over with them what our options are and how much it's going to cost and how to space this out if we need to, or how to do it all at once or whatever, if we're not having financial discussions with our patients, they're not fully on board because until they know how much something costs, everything sounds okay. I mean, not that they love coming to the dentist, but everything sounds like, okay, sure, until they find out what the bill is going to be or until they find out how much it's going to be. And so in order for us to fully get a patient on board for the dentistry they need, we not only need to talk to them about their clinical needs, but we also need to work out the financials with them. You wouldn't walk into any other business and not know how much something's going to cost before you buy it. You need to make sure that the patient understands, and maybe we need to talk about financial options for them and financing and all of that, but that's part of the buying process. And to get a patient fully on board to show up for their appointment, we need to go through this process with them. The final thought behind that is, if you don't want to make a customer mad, don't do the dentistry, don't give them the service and then tell them how much the bill is, right? Don't collect or try to collect after you've done the dentistry. So there's about 7 reasons, I hope, for this person who wrote into me who can take this back to their dentist. And let's talk about how can we fix our processes, because it's just a better scenario for the patients, better scenario for the team, better scenario for the dentist. And at the end of the day, we're here to help our patients keep their teeth for life. So we need to be able to be confident and comfortable and efficient and be able to walk them through this if we're really going to help our patients. So thank you for the question. I'm super glad that you guys are here listening and growing and learning. And until next time, have an amazing day.